Med History.
Anthrax is an acute, particularly dangerous infectious disease that occurs in humans and animals when infected with Bacillus anthracis, occurring with the formation of specific carbuncles on the skin or in septic form. The source of infection is wild animals and livestock. Infection occurs through contact. The incubation period of anthrax is on average 3–5 days. Diagnosis is carried out in 3 stages: microscopy of sputum or excretory skin elements, backsewing, bioassays on laboratory animals. Anthrax is treated with penicillins. In the cutaneous form, it is combined with local treatment of ulcers and carbuncles. The source of infection is large, cows, moose, deer, and small cattle, sheep, goats, hoofed animals, horses, pigs, to a lesser extent various wild mammals, wolves, foxes, hares, bears, even more rarely dogs and cats, which secrete the pathogen with urine and feces. The animals themselves become infected by inhaling or swallowing the spores of the pathogen. Infection from humans is possible, but it is extremely rare. Anthrax is generally considered a non-contagious disease, with the exception of actively rubbing skin secretions into wounds of another person. Animal burial grounds, including unaccounted-for ones, in which the pathogen can persist for many decades without disinfection, are of great importance in the spread of infection. In these cases, natural disasters can have an increased risk. Heavy rains, floods, and landslides, which cause anthrax spores to appear on the surface. Symptoms of anthrax. The incubation period is usually 3 to 5 days, but sometimes it can take up to a week or two and last for several hours. Anthrax most often manifests itself in the form of carbunculosis. At the same time, a carbuncle is formed on the skin at the site of the introduction of the pathogen, which then undergoes various stages, including a stain, papule, vesicle, and ulcer. First, a painless red spot forms, which quickly turns into a copper red, sometimes purple, papule, raised above the surface of the skin. At this stage, patients usually complain of itching and burning of the affected area. After a few hours, the papule turns into a vesicle with a serous fluid with a diameter of 2 to 4 millimeters. As a result of hemorrhage, the contents of the vesicle soon become dark, sometimes purplish-purple. The vesicle can open, independently or by combing, creating an ulcer with a dark brown bottom, raised edges, and a detachable serous hemorrhagic character. In a typical course, the primary ulcer is girdled with new vesicles, which merge upon opening and increase the ulcerative defect. A few days later, a black necrotic scab forms in the center of the ulcer, gradually replacing its entire bottom. The carbuncle looks like a burnt crust, painless, surrounded by a purplish-red inflammatory roller rising above the unaffected skin. The tissues around the carbuncle are pronounced edematous. Often the edema captures a significant area, especially in the case of localization in places with loose subcutaneous tissue, for example, on the face. When the carbuncle is located on the face, there is a high probability of swelling spreading to the upper respiratory tract and the development of life-threatening asphyxia. The disease is accompanied from the very beginning by significant intoxication, headache, weakness, adynamia, muscle aches, lower back, possible abdominal pain, fever. After 5 to 6 days, the body temperature decreases sharply. There is a regression of general and local clinical manifestations. The scab is rejected after 2–3 weeks. The ulcer gradually heals, leaving a rough scar. As a rule, a carbuncle is formed in a single copy. In rare cases, their number can reach 10 or more, which significantly aggravates the course of the disease. The greatest danger is represented by carbuncles on the head, neck, mucous membranes of the oral cavity, and nose, which noticeably worsen the course and threaten to become complicated by sepsis. The edematous form at the first stage is limited by the swelling of the tissues. The carbuncle is formed later and is quite large in size. The bullous variety is characterized by the formation of blisters filled with hemorrhagic contents in the area of the entrance gate of infection, which transform after opening into extensive ulcers progressing into carbuncles. How is anthrax transmitted? Contact pathway: when cutting carcasses, caring for sick animals. Contact with meat, wool, and fur products. When spores or vegetative forms get on injured skin or mucous membranes. Airborne dust: when inhaling contaminated bone meal and dust, for example in the area of a cattle burial ground. Food and water: when eating contaminated meat and water. Transmissible: through the bites of mosquitoes, horseflies, midges, and flies. Hemocontact, through injection in heroin addicts, a rare, recently discovered route in Northern Europe. The infection enters the body through the skin and mucous membranes of the respiratory and gastrointestinal tract. When infected through the skin, the process is most often limited. The pathogen multiplies in the thickness of the skin and produces a toxin. This causes damage to the endothelium, the layer of cells lining the inner surface of blood vessels, increased vascular permeability, hemorrhages, serous hemorrhagic inflammation, pronounced edema, and loss of sensitivity in the affected area. With food and respiratory infection, the bacterium easily passes through the lymph nodes and spreads with blood throughout the body, causing infectious and toxic shock. Thrombohemorrhagic syndrome, a combination of thrombosis and bleeding, and sepsis. Complications of anthrax, infectious and toxic shock, at the peak of fever, severe weakness, deafness, severe headache, decreased blood pressure, hemorrhagic rash, multiple organ failure. Sepsis, inflammatory processes in all organs, accompanied by a systemic inflammatory reaction and disruption of their work. Meningoencephalitis, fever, excruciating headache, vomiting without relief, mental disorders, meningeal symptoms, acute respiratory failure, lack of air, shortness of breath, psychomotor agitation followed by depression, cyanosis of the skin. A doctor may suspect anthrax based on epidemiological history data, visits to animal burial grounds in regions unfavorable for cases of the disease, contact with animals, livestock products from farms, and the characteristic type of cutaneous form of anthrax, anthrax carbuncle, a black scab with a corolla of hyperemia, redness, and gelatinous edema around. Anthrax prevention includes the following measures. Avoid contact with animals in areas where there are cases of the disease. Do not consume undercooked meat or unboiled water in these areas. Timely identify and destroy sick animals. Burn corpses, meat and skins of fallen animals. Carry out disinfection in the focus of the disease. Comply with the norms when processing animal products. In case of possible infection, consult a doctor. Undergo emergency prophylaxis with immunoglobulin and antibiotics for 5-7 days. You should also inform your doctor about possible contacts with infected people.